This is Jenna Nikina on eyesurgeontalks. In this video, I will be talking about why some retinal operations fail. Now, this is clearly a very emotive topic. If you're going in for an eye operation, you're hoping that things will work out well and everything will be better, you're looking forward to better vision. And unfortunately, a small proportion of operations don't fulfill your expectations. And I think it's important to think of it in those terms. There is a little bit of a disconnect sometimes between the way we as surgeons perceive success and the way our patients perceive success. And I think actually this is the biggest issue in assessing and quantifying and looking at whether an operation has been successful. And then besides that, there are also the operations which do actually fail, which don't achieve their desired outcome. So we'll look at those two aspects together. So first of all, operations such as retinal detachment repair, such as vitrectomy for macular holes, vitrectomy for epiretinal membranes. These are operations that we do thousands and thousands of, and they're pretty common, the techniques are pretty established. But it's very important to have a conversation with the patient before the operation to explain that actually, if, for example, your retinal detachment has involved your central vision, even if the operation has been successful in the purely anatomical sense, in that we get the retina back where it belongs, and it's nice and stable, it's attached, your vision will still never be the same as it was before. There will always be some distortion in the vision, there will always be a change in size of images. Sometimes this is minor and sometimes it's quite pronounced, and people have different levels of how much it bothers them and different ability to cope with the symptoms as well. But it's something that we do need to talk about. And even routine operations such as macular holes and epiretinal membranes, the same thing applies. The vision will never be quite as good as the way nature made it originally. Because once there is some sort of insult to the retina, once there has existed an epiretinal membrane or macular hole, it's unusual for the retina to recover fully, even if we remove that insult. If you test the vision very carefully, there's always some little bit residual weakness, blurring in the center of the vision, or some distortion that persists. And this is quite normal. And this is something that needs to be explained and understood before you do embark on the operation. If you do expect your vision to be perfect afterwards, then unfortunately often it can be perceived as a failure that it is not. However, our techniques are not quite as good as Mother Nature. And then why do some operations frankly fail? So fail on all aspects. So we consider them as having not worked, and you consider them as not having worked, with your vision not getting better. Well, if we take something like an epiretinal membrane operation, barring any serious complications during surgery, which are rare but can happen, if the operation itself did go well, sometimes the epiretinal membrane can come back. This is rare. This is 5% of the time or less, according to the literature. But if it does come back, then obviously you will continue to have the same symptoms. And you can have the same operation again. But again, sometimes it can be difficult to achieve the level of vision that one would hope for. With something like a macular hole operation, the obvious one here is the macular hole can fail to close despite our best efforts. Now, what factors increase the likelihood that this will happen? So the longer the macular hole has been there, the less likely it is to close. The bigger the macular hole, the less likely it is to close. And there are a few other factors. Those are the two main ones that affect surgical success with macular holes. And if they do fail the first time, we can try again. But unfortunately, the success rate of second surgery is significantly less than the first operation. And also the potential visual improvement is not always there. The other thing to say about macular holes is that sometimes we achieve what we call anatomical success. So Your OCT scans look lovely, the hole is closed, the retina is joined together, but unfortunately, the photoreceptor cells, so the little cells at the bottom of the retina that sense the light and that allow you to see, they just have been damaged by the fact that the hole was there. They've disappeared, they've died away. And if we join the kind of cabling layers of the retina all together, those cells, they don't always regenerate. And so you continue to have this little missing patch in the center of the vision. And again, unfortunately, this is not something that we can solve, and it can occasionally be a disappointment. With retinal detachment surgery, now this one, the failure rate, if you think of failure as a retina not reattaching successfully, the failure rate is actually relatively high. So the success rate of retinal reattachment is about 90% with one operation or uncomplicated detachments. So that means that 1 in 10 patients will suffer another retinal detachment where the retina fails to attach. And this is, again, something that we should discuss with our patients, because that chance is high enough for it to be, not that uncommon. Now, retinal detachment surgery fails for a number of reasons. One of the reasons is that there is another break in the retina. So retinal detachment tends to happen when there's a hole in the retina that forms as a result of aging changes in the jelly of the eye. And during the operation, we need to find all the little holes in the retina that are there and sort of weld them down, close them up so that they don't cause another detachment. Now, if we miss a little hole, or also if you get another little hole developing as the retina heals after surgery, then another retinal detachment can develop. Another, and probably the most sort of significant and the commonest reason for detachments to fail, detachment surgery to fail, is that you get some scarring changes in the retina. This is something called PVR, proliferative vitreoretinopathy, and this is our biggest enemy in retinal detachment. We don't fully understand the process of why this happens, but if you get scarring on the surface of the retina or underneath the retina, the scarring pulls in, and that can lift the retina up from the layers underneath. And then, it's not a matter of sealing a hole and putting the retina back. We have to actually go in and remove that scar tissue and try and smooth the retina out. And this process is very troublesome. The process itself of the scar formation takes about 8 weeks. And so once we see this scar formation after retinal detachment surgery, then we usually need to reoperate and often need to adopt a staged approach with multiple operations and also the use of silicone oil inside the eye, which is able to keep the retina stable for longer and allow us to deal with the scar tissue in a suitable manner. So those are the common reasons for retinal detachment surgery to fail. One can be thought of as a failure of expectations, a failure of the vision to achieve a level that was expected. There may be anatomical success, there may be surgical success, but there's still disappointment about the level of vision. And the second is frank failure, where the operation hasn't succeeded in its aim, and different approaches we can use in order to mitigate what's happened.